The goal for inpatient rehabilitation hospitals is to get the patient independent and home. For most patients in their acute care stay, the inpatient rehabilitation hospital fits the bill best. I have access to medical resources in the inpatient rehab hospital that I don't have access to in a skilled nursing facility.
Generally speaking, majority of our cases, we have strokes and we have brain injuries, whether it's traumatic brain injuries, non-traumatic brain injuries, we have spinal cord injuries, we have neurological conditions such as multiple sclerosis and Parkinson's, cerebral palsy, ALS. So you have really a variety of diagnoses. In acute rehabilitation stay, you have that personal physician that's always in charge of your care. And that's something that my specialty comes in place. That's physical medicine rehabilitation. That's how I define myself to the patient, and they understand that I'm going to be there for all their needs, whatever it is, guiding the therapy, making sure the condition is not flaring up on them, making sure we're addressing all the issues from overall general standpoint to get them home, to be independent, and to be basically how they were before something happened to them. In acute rehabilitation stay, nursing care is one of the most important factors. So you have 24-hour nursing that cover all aspects of patient care. The ratio is pretty small in terms of nurse to the patient ratio. So you have really that specialized, personalized care with the nursing.
There are subspecialty certifications for nursing that are rehab nursing certifications, which is really handy.
The patient has to undergo at least 3 hours of therapy a day, mixed between physical, occupational, and speech therapists. We accommodate the therapy individually. They're all registered therapists. They're all hands-on, and patient is getting multiple therapies a day. In acute rehabilitation hospital, what we have is we have state-of-the-art technology. We have exoskeleton, and we have the robotic arm, and we have the ADL suite. We have all the technology available to the patients that will provide them that individualized care that will allow them to go home and be independent again.
I think the most important aspect of inpatient rehab is to get the patient independent so that they can return home. That's not necessarily the goal at a skilled nursing facility. We now know from lots of studies that patients that go through an inpatient rehabilitation facility, they're discharged sooner, they stay home longer, they have fewer admissions to the emergency room or hospital readmissions, and they live longer. That's what I would be considering, and that's what I tell my families.